Good morning, everybody. Good afternoon, wherever you are. Good evening. Welcome, and thanks for joining us. I'm here, I'm Carolyn Hart with JSI, and I'm here with several colleagues from Ethiopia, and we're really delighted that you're able to be listening in. Please say hi and where you're from in the comments whenever it is that you're listening to this. Thanks. We'd love to know who you are. This is the third in the series of conversations on global health supply chain best practices that JSI is offering. And today, it's all about Ethiopia. And the topic is the benefits of streamlined health commodity traceability. It's a really precise and specific technical story about linking health product import permit applications through the the Ethiopian Food and Drug Administration and the Ethiopian Trade Single Window. This is a significant step in integrating the necessary information to ensure health product traceability. So through this step of integration, the government of Ethiopia gains the compliance and visibility from all importers of health products, whether the products are government funded or coming from donor sources or through the private sector. This is a very high profile and government-led initiative that we're honored to be a part of. As I said, it's a really specific technical story that I know that practitioners in the regulatory, procurement, supply chain, and digital health fields will all find fascinating. So having said that, I'd like to introduce today's host, who's my colleague, Mr. Al Shiferaw. Al is the Deputy Chief of Party and Technical Director for the USAID Digital Health Activity in Ethiopia, which JSI is USAID's partner in implementing. It is the primary digital health project funded by USAID to assist the Ethiopian government in its digital transformation in the health sector. Al is also JSI's principal representative on technology matters in Ethiopia and provides the suite of projects that we have there with overall guidance on many aspects of digital health, from implementation to strategy. So, Al, may I turn it over to you?
Thank you, Carolyn, and thank you, everybody. Morning, afternoon, wherever you may be. And welcome to our colleagues and friends who's joined us today. So let me start by introducing my colleagues. It's been, frankly, very much an honor to work with different agencies that the USAID project in Ethiopia has been working on, starting with the Ethiopian Food and Drug Administration, and then, as you'll soon hear, on the Ethiopian Single Window system. So starting with Ms. Heran Gerba. So Heran Gerba is the Director General of the Ethiopian Food and Drug Administration since 2019. Prior to that, she served as the Deputy Director of the same organization for a number of years. Heran has been the leading voice and advocate for the establishment of the Ethiopian traceability operations from inception, from the time she was the Deputy. Also, the person responsible for the creation of the Traceability Office within EFDA and the passage of the Ethiopian Traceability Directive. And my colleague, Mr. Robel Tesfaye, is from the Ethiopian Single Window Program Office. He serves as the Program Director for the project. He will tell us a little more about the project and the Program Office. The Program Office is a multi-sectoral owned agency that is co-led by the Ministry of Revenue as well as the Ethiopian Customs Authority. Robel led the initial team that launched the first phase of the electronic single window at the Prime Minister's office a few years back. And prior to that, Robel was also the project manager at the Information National Security Agency, INSA. Last but not least is my colleague, Teddy Berihun, who is the COR of the USAID Digital Health Activity Project. Teddy joined USAID in February of 2016, where his role is a senior HIS advisor. He works very closely with the Ethiopian government and various healthcare stakeholders to ensure sustainable, user-friendly health information systems. And Teddy is very much involved in the traceability initiative that Ethiopia has been pursuing for the last number of years. So welcome everybody. And I'll start with my question with Mr. Robel. We believe that it is important to set the foundation because a lot of you may not know much about the Ethiopian Single Window as much as you know about the Ethiopian Food and Drug Administration. So, Robel, if you can maybe start by giving us some background on the inception of the Ethiopian Single Window system, why it was set up, and takeaway that your office has learned from the integration work that we've done with EFDA. Over to you.
Thank you, everyone, for having me. It's my pleasure to meet you all here. Actually, 5 years ago, the government of Ethiopia had identified key pain points in the international trade arena or in a national supply chain area. So the government, what the government had identified then was the first thing is time efficiency and cost effectiveness to process regulatory requirements. And the second limitation was the lack of good governance in the arena and the being prone to corruption and the account for low customer satisfaction. And the third issue that was raised during that time was lack of visibility, transparency, and traceability, both from trader side and government side. So to mitigate those previously mentioned issues or pain points, the government had come up with a solution. The solution is to implementing and make the National Single Window platform operational. The system or the National Single Window platform is a facility that would actually allow traders to electronically submit their trade-related applications in a centralized or in a single entry point to the government organizations and get approvals from those regulatory organizations. Currently, we are able to actually link our system with 3 key organizations. The first one is Ministry of Trade and Industry for business license verification. And the second one is the Ministry of Revenue for tax ID verification. And the third one is Ethiopian Customs Commission system to share permit approvals to process custom-related clearance activities. Currently, actually, potentially, almost about 100 autonomous organizations are expected to be users of the system, and more than 50 autonomous entities have started using our system. The fascinating thing that we have done with EFDA is interfacing our system with EFDA supply chain system, which is the first and most valued and can be considered as an exemplary interoperability activity. We have achieved actually direct bidirectional interfacing between the two systems. With this interoperability activity, we have achieved the lowest possible processing time. We can consider it in a matter of seconds to process a single permit through the interfacing activity. And we are actually proud that the integration work has contributed a lot in achieving this three key goals. And the first one is increasing customer satisfaction. And the second one is offering improved data visibility and transparency. And the last one is creating a single entry point or a single window, electronic window for traders to submit their applications and get approvals from the EFDA. Last but not the least is the cross-functional learning or cross-learning and collaboration between EFDA and Single Window Office teams. That was an important and actually exciting capacity building opportunity. This is the things that we have achieved so far with collaboration with EFDA. Thank you.
Thanks so much. So moving over to EFDA, maybe I can ask a question that links to what Robert just said. So if Heron if you can please give us some background on the impact of the integration that was done with a single window and how this broadly affected the core mission of the agency.
Thank you very much, Al. Good morning, good afternoon, everyone. Thank you for having me in the session. So in the broader terms, the integration between these two systems has impacted the EFDA a lot, and I want to raise around 4 points that are high-level impacts in terms of setting up the objective. Primarily, just in terms of client satisfaction, as Robel has indicated, our clients are quite happy because in terms of the speed of service, import clearance is being manageable within seconds, and clients are getting approval instantly, virtually, and the system checks also checks the validity of the importer's license and the market authorization, and cross checks with the registered medicine list or registered medical equipment list. That's the national product catalog. And this is also because it is linked with our electronic regulatory information system. This can be done easily in terms of tracing back whether the medicines are registered or authorized by EFDA or not. So in terms of EFDA ensuring its major objective of delivering patient safety through ensuring the safety and quality of products, this has impacted a lot. The second point is the import process will go smoother because the single window imports permit system is the one that's formally recognized by the Ethiopian government. And in terms of product availability, it has improved the lead time for importation. This has a direct impact on accessibility and availability of especially essential medicines wherever it is needed. And the third point is in terms of data visibility and transparency. The integration has meant that the authority can be confident enough in the imports of all medicines and medical equipment that come through the country because it's fully known in advance on who imports from abroad. And what this means is that the authority has full insight of what's coming to the country, and it has a comprehensive data so that the government or the regulatory body can take decisions or actions whenever it is needed. Last but not least, the fourth point is because of the integration, the systems at EFDA has become even stronger. There are a wide users going into the system through the single window, and this has allowed the EFDA to leverage the broader government system rather than trying by itself enforcing the import permits on its own. So we use the government system at a broader level so that we can a lot of users can really go into the system, and all products that are coming in are traced and tracked in terms of the genuinity. Thank you so much.
Thank you, Heran. Very much appreciate that really comprehensive response. So if I may go back just very quickly, Robel, I'll give you 30 seconds. If there's any next steps that the single window has planned for the future, if you can just brief that, please.
Okay, thank you again. Actually, as an immediate next step, we would like to build on the success of this activity and have already started and to integrate the pre-shipment and post-clearance system features of the EFDA. Next to that, we are actually planning as a phased strategy to implement digital payment or electronic payment system feature. That will be another big move that we are doing actually with National Bank and other banks. And those two activities are the activities that we are planning to further scale up our collaboration work with EFDA and other financial institutions. Thank you.
Thanks. Thank you, Robel. Appreciate it. Over to you, Carolyn.
Okay. Thank you, Al. In addition to what Robel has said, in terms of the areas for the next steps, we would like to see this electronic integration both from the suppliers and the data aggregator side, such as the Global One and the upcoming Global Trust Repository for Vaccine into this platform. So Ethiopia, in terms of the COVID vaccine as well, this would be a big milestone in order to really work on the electronic integration from this point of view. And to this end, our next step would be to continue the work further, extend our integration with the electronic trade window system to receive data both from the pre-shipment as well as from the post-clearance stages as well, so that we will have an upstream data visibility information. And then the last next step would be exploring similar integration with the Ministry of Trade because they have their own system. So we give the certificate of competency and then they give the trade license. So these two systems should be integrated. And we are working on the iLicense system from our side. And if we integrate that, then we will be at a better position to tackle fake documents, fake company licenses, and trace the genuinity of the licenses that are being presented at the port of entry in terms of clearance. Thank you very much.
Thank you, Eran. Over to you, Caroline.
Thanks, Al. I get to ask Teddy the last question. So Teddy, from your perspective, both as a funder and a digital health and information systems practitioner, what's the big picture? How does this work complement the vision for Ethiopia's digital transformation in health?
Thank you so much, Caroline. I'll be very brief. As you can hear from both two government people, I think for USAID, in terms of funding this activity, what we have learned is the people, the process, the technology are all coming together. As you have seen, also the ownership and the self-reliance is already reflected. Both agencies, government counterparts are leading it, and we are just facilitating and providing that technical assistance. And JSA has been very instrumental in making sure that ownership has been there from the beginning. And then we would like to take this lesson and apply it in all other work that we are doing in terms of the digital transformation in the health sector. So I'm very proud of this work. And then the next step that are going to be coming in. We are already reaping the benefit, as you can hear at the last point mentioned in the COVID vaccine tracking, where we're going to be tracking the vaccine from port of entry all the way to the last point, as well as the upstream visibility as soon as we get the data being shared from this. So it's really good opportunity for USAID to see something like this. Thank you.
Thanks, Teddy. Much appreciated. And actually, Al, I think we have a second or two to give you the very last word on sort of bringing it all together.
Thank you, Caroline. Appreciate that. And thank you again for everybody. So I think I just want to summarize it in two different points. We talk a lot about the national traceability systems. And I think what we've learned today is the local traceability system with pharmaceuticals are much better strengthened when they're under the umbrella of an overall national traceability system. So in Ethiopia, what we saw was a hook that EFDA was able to leverage using the overall national single window system. And last but not least, when we think about downstream traceability, we believe that if you don't get your upstream traceability right, it's going to be very difficult to get your downstream traceability going forward. So with that, I want to thank everybody. And thank you everyone who's joined us online and throughout the world for this session. Thank you.
Thanks. Bye.
Bye.
Thank you. Thanks so much.
Thank you.